Welcome guys. In the previous session, we looked at histamine. You can recall this was histamine. In today's session, we'll be looking at serotonin. And if you can remember, when we were discussing about serotonin, I told you to keep in mind this drug known as cyproheptadine, which is a first generation antihistaminic drug, which is moderately sedative. If you can remember, we said the first generation antihistaminics can cross the blood-brain barrier, so they are centrally acting. One of the adverse effects is that they cause sedation and they also psychomotor impairment. And also we say they have anticholinergic activities. That is why one of the adverse effects is a dry mouth, constipation, urinary retention, etc. Now, today we'll be looking at serotonin, and the reason why I told you to keep in mind cyproheptadine, you will see that it has some action on a serotonin receptor. So, welcome all. My name is Oris Munyeri, and I'm the Daktari. So, serotonin, which is also known as 5-hydroxytryptamine, okay, is usually synthesized from the amino acid tryptophan. Tryptophan usually has an indole ring. Now, if you can remember, tryptophan is usually hydroxylated at position number 5 by the enzyme L-tryptophan 5-hydroxylase to form 5-hydroxytryptophan, which is then decarboxylated by the aromatic acid decarboxylase to form now serotonin. Okay, if you can remember that. Then, if you have done your biochemistry very well, you can remember in the pinealocytes, in the pineal gland, serotonin will be further acetylated by the serotonin N-acetyl transferase to form N-acetyl serotonin, which will further be methylated by where we will use S-adenosyl homocysteine SAM as the methyl group donor. In fact, it is S-adenosyl methionine as the methyl group donor. We will use it as the SAM or adomate, and the enzyme which catalyzes that reaction is the hydroxyindole or methyl transferase to form melatonin, which is involved in your circadian rhythm. But today we just look at serotonin, which you just form it, you hydroxylate, then decarboxylate tryptophan. Now, these steps are similar to those of catecholamine synthesis, except in that in catecholamine we use tyrosine. Now, serotonin is usually stored in vesicles, and it is usually taken up by the vesicular amine transporter, VAT, which is usually inhibited by the drug reserpine, if you can remember that. Then its action, once released, is terminated by reuptake. Then it will be catalyzed by the monoamine oxidase, okay? By the monoamine oxidase, monoamine oxidase, okay? It acts on several serotonin receptors, 5-HT1 to 7. All of these receptors are G-coupled, G-protein coupled receptors, except for one, which is ion linked channel, and ionotropic. So all are metabotropic except for one, the 5-HT3. Okay, so what are some actions of serotonin? Now, one, on IV injection, it usually produces a triphasic response or a triple response on blood pressure. So there will be an early sharp fall, which is due to the BEZOLD-JARISCH reflex. This BEZOLD-JARISCH reflex was first described by Bezold in 1867 and confirmed by Jarisch in the 1938 to 1940, where it is a triple response where there will be, if I can draw a triangle here, there will be apnea, okay, apnea. There will be hypotension, and bradycardia. Okay, so the receptors which mediate this reflex are usually found in the left left ventricular chamber, and they are chemoreceptors. Once they detect alkaloids from the alkaloids such as serotonin, or from a plant known as veratrum, they mediate this reflex. Okay, so the afferent limb of mediating this reflex come from the vagal afferents. Okay, so there will be first, if this is on blood pressure, there will be a sharp decrease. Okay, then a brief rise. Okay, due to vasoconstriction, then a prolonged fall. Okay, so this is the triple response: an early sharp decrease due to the BEZOLD-JARISCH reflex, then followed by vasoconstriction, so a brief rise, then a prolonged fall due to arteriolar dilation. Okay, please remember there's triple triphasic response of serotonin. Once injected, how will the blood pressure behave? Now, serotonin is also a powerful stimulator of smooth muscles. It increases peristalsis and constricts bronchi. So we have some tumors which produce serotonin, the carcinoid tumors. Okay, so one of the signs and symptoms of carcinoid syndrome is diarrhea. And now you understand why there will be a diarrhea, because serotonin will increase peristalsis. Also, serotonin is gastroprotective. How is it gastroprotective? It usually decreases acid secretion, but increases mucus production. So it protects the gastric mucosa. Also, serotonin is involved in the regulation of sleep, cognition, our behavior, and mood. Remember, in the random eye movement, sleep, serotonin was being involved. Also, in the pain perception, you can remember the gating mechanism of pain, serotonin was being involved. Also, serotonin increases platelet aggregation. This is usually mediated by these 5-HT2 receptors on the platelets. Okay, so now let's go back to the synthesis of tryptophan. This hydroxylation step is the rate limiting step. Okay, it is the rate limiting step, and it is usually inhibited. The tryptophan hydroxylase is usually inhibited by two compounds. One is known as chlorophenylalanine and chloroamphetamine. Okay, so all of them are para. So para-chlorophenylalanine and para-P, that P is para-chlorophenylalanine and para-chloroamphetamine. These two inhibit the enzyme tryptophan hydroxylase. And I told you the uptake of tryptophan into the vesicles is mediated by VAT, which are usually inhibited by rezapine, which you can remember. Even we said that when we were discussing the synthesis of the catecholamines. Now, how is it broken down? Serotonin, I told you, is once it is first reuptaken from the synaptic cleft, then they be inactivated by monoamine oxidase to 5-hydroxyindole acetaldehyde. Then the acetaldehyde is dehydrogenated by the acetaldehyde dehydrogenase to 5-hydroxy. The 5-hydroxyindole acetic acid. So this compound is usually elevated in urine in patients with carcinoid syndrome or the carcinoid tumors. So that is how you can investigate carcinoid tumors. Now, receptors. This is important. Serotonin usually acts through, we have seven. These are we have 5-HT1 to 5-HT7. 6 are metabotropic or G protein coupled surface receptors, only one, this one, 5-HT3, is ion linked, okay? It's ionotropic, okay? Then even under this, we have, if under 5-HT1, we have subclasses. We have 5-HT1, 1A, 1B, 1D, 1E, 1F, P. So I won't bother you with those much details, but 5-HT1, what I need you to understand is that it is a autoreceptor, presynaptic. So it is GI, okay? GI, okay? So its activation inhibits release of serotonin. So it modulates the release of serotonin, okay? So then we have 5-HT2. We have 2A, which are found in the 2A are found in the platelets, the smooth muscles, okay? And it is 2A is GQ. So remember GQ, and I say GQ, I hope you understand what that means. And we have 2B, 5-HT2B is found in the stomach, pandas. Also, it is GQ. We have 2C. 2C itself, it's found in the choroid plexus, the hippocampus, and the substantia nigra. Okay. Then we have this, the only ionotropic, which is found in the area postrema. Area postrema, also in the sensory and enteric nerves. The area postrema is the chemoreceptor, chemoreceptive trigger zone. Okay, the CTZ, chemoreceptive trigger zone. Now, it is a sodium. This is a sodium stroke potassium channel. Okay, so please remember that 5-HT3 is an ionotropic receptor, but the others are metabotropic. Okay, now 5-HT4 is found in the GIT, also in the CNS. Then 5-HT5, we have A and B, both are found in the brain. Then 5-HT6 and 7 are also found in the brain. Now, okay, I think, okay, can we, maybe I had told you about the BEZOLD-JARISCH reflex. Please remember that reflex. Okay, so maybe we can now go directly to the drugs. Okay, we can go to the drugs. Now, 5-HT1A, we have a partial agonist known as buspirone, okay, isapirone, and gepirone. So please remember buspirone, this one. And it is an anxiolytic drug. Anxiolytic in that it is an anti-anxiety drug. So when one feels anxious, you can use buspirone, which is a 5-HT1A agonist, to relieve that anxiety. So it is anxiolytic. Okay. Then 5-HT1B and D, their stimulation will cause constriction of cranial vessels. Please remember that, constriction of cranial vessels. So by constricting the cranial vessels, they will prevent the stretching of the pain endings located in the walls of those blood vessels. So by considering that, you can use them in the treatment of acute migraine attacks. I will cover a session dedicated entirely to migraines. Okay, so just remember that these receptors, 5-HT1B/1D, cause constriction of cranial vessels. So they are agonists, such as the triptans, the triptan drugs. They are the anti-migraine drugs, and they include sumatriptan, rizatriptan, provatriptan, elatriptan, almotriptan, zolmitriptan, Okay, so they are anti-migraine drugs. So please remember that. Then we have this 5-HT2A stroke 2C. I told you they are GQ, and they are responsible for most of the direct actions of serotonin on the smooth muscles. And they are antagonists such as ketanserin and ritanserin are useful as antihypertensive agents. Okay, so please remember that. Okay, so that ketanserin and ritanserin, they can be used as antihypertensive drugs. Also, they can be used in vasospastic conditions. Okay, then we have clozapine and risperidone are atypical antipsychotic agents that act through antagonistic activity at this receptor. So please remember that. But also, clozapine, I think, also acts on 5-HT6. It is an antagonist at 5-HT7. Sorry, it is an antagonist also at 5-HT7 receptor found in the brain. That's why they can be used as atypical antipsychotic agents. Then 5-HT3, this I told you to remember that it is the only ionotropic receptor among the serotonin receptors. It mediates most of the reflex and indirect actions of serotonin. We have very important antagonists, which include ondansetron and its analogs, namely greensetron and tropisetron. Okay, and they are agents of choice for the treatment of chemotherapy-induced vomiting. Okay, so some chemicals usually trigger the chemoreceptive trigger zone in the area postrema, and this will cause vomiting. So you use antagonists to the 5-HT3 receptors to prevent this vomiting. But one of the major adverse effects of this ondansetron and its analogs is that they cause a small QT prolongation on your EKG. So they are contraindicated in patients who are using other drugs that can cause a QT prolongation. And I told you in the previous video on histamine that we have some second generation antihistaminics drugs such as your tafenadine and astemizole, which cause a QT prolongation. So you don't want to combine the ondansetron or its analogs with those drugs. That would be bad, because they will now cause the polymorphic ventricular tachycardias, the torsades, the pointers. So please remember that. Now 5-HT4, which are present in the GIT, also in the CNS, they are responsible for increase in peristalsis, and I told you that is why in carcinoid syndrome, where you have high amounts of serotonin, those tumors produce serotonin, the manifestation will be diarrhea, because there will be increase in peristalsis. Now we have agonists such as cisapride, mosapride, renzapride, and tegaserod. And these are useful in the treatment of gastroesophageal reflux disease, GERD. Okay, and cisapride is a prokinetic, because it will, if they are agonists, they will induce peristalsis. So it is a prokinetic. Okay, so and they can also, cisapride can also be used to treat gut motility disorders. Okay, but also tegaserod can be used to treat irritable bowel syndrome with constipation, because you understand that they will promote gastric emptying and also enhance small and large bowel transit, but it has no effect on esophageal motility, and also increases stool liquidity. So that is why it can be used during constipation, because it will increase the liquidity of the stool. Okay, now other non-selective drugs. I told you to keep in mind cyproheptadine. Now, cyproheptadine has potent H1, okay, H1 receptor blocking activity, also can block 5-HT2A and also muscarinic receptors. Okay, so it can be used. So it usually increase appetite because it acting on the serotonin receptor. It will increase appetite and can be used in children to promote weight gain. Also, that is not the only indication of cyproheptadine. You can also use it for the treatment of the manifestation of the carcinoid tumors, because it can block this receptor. So also it can be used in the treatment of cold-induced urticaria, where the patient, once the patient comes into contact with cold water, they have an itch and they develop some rashes known as hives. Okay, so please remember the indication of cyproheptadine. So the treatment of carcinoid tumors, cold-induced urticaria, and also can be used to promote weight gain in children because it increases appetite. Now, we have these two. These two, I will discuss them in a separate session, but let me just talk about them. These two are known as EGOT. They are EGOT alkaloids. Methoxide, which is a 5-HT2A and stroke 2C antagonist and 5-HT1 agonist. Okay, and it is indicated in the prophylaxis of migraine attacks, but prolonged use can result in pulmonary, also endocardial and retroperitoneal fibrosis. So you don't want endocardial fibrosis because that will lead to valvular and electrical failure of the heart. Okay. Then LSD means lysergic acid diethylamine, which is an EGOT derivative. EGOT derivative means that it comes from a fungus known as Claviceps papyri. We will be talking about that. And it is a powerful hallucinogen. It is a psychedelic, okay? And it acts as an agonist at several serotonin receptors, including 5-HT1A, 2A/2C, and through also an agonist at 5-HT5, 6, and 7 receptors. So please, we are done with serotonin. Next, we'll be looking at EGOT alkaloids and migraine. I'll take some time on migraine when the time comes. So stay tuned, and yeah, I think we are done with serotonin. Thank you.